5 to Thrive. And Ryan, 19 minutes from 95. That's traffic. I'm Jim Talamonte on AM 560, The Answer.
Chicago's Morning Answer continues next. In our AM 560 Weather Center, meteorologist Steve Williams.
A hot, humid day. It'll be mostly sunny. High today 94. Partly cloudy, warm tonight, low 74. Partly sunny, a hot, humid day tomorrow, the high 94. And then sunny and hot again on Wednesday, a high at 96. I'm Steve Williams on AM 560, The Answer.
Already warming up 77 at O'Hare. Next news 8:30. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. This is Chicago's Morning Answer with Dan Proft and Amy Jacobson on AM 560, The Answer.
Offices and mayor's offices and positions of authority in K through 12 education, or frankly, collegiate education for that matter. The idea comes to us from our friends in Japan. A Japanese group is trying to take people's minds off COVID-19 by putting them in coffins surrounded by chainsaw-wielding zombies.
What?
Customers in Tokyo can lie in a 2-meter windowed box listening to a horror story, watching actors perform, and getting poked with fake hands and squirted with water. The coordinator of the production company putting this on,
You sure this isn't a haunted house early?
Scare Squad. The pandemic is stressful, and we hope people can get a bit of relief by having a good scream. Scream it out. I like
Work it out now, yeah.
And it's only about
how much?
$7.50 a show.
Oh,
It's sort of like those.
that might push me over the edge.
Sort of like those rooms, those tantrum rooms you can go to and just destroy everything.
They had one near Navy Pier.
Maybe they should install one in every governor's mansion. We mentioned this op-ed in the Wall Street Journal last week by Dr. Joel Zinberg. This strikes me as such an important part of the COVID-19 story and the administration's response. I don't know why it's just being told now. So we got Dr. Zinberg on the program to help us understand. Dr. Joel Zinberg, he's also a JD. He's a senior fellow at the Competitive Enterprise Institute in D.C., associate clinical professor of surgery at the Mount Sinai Hospital in New York. Dr. Zinberg, thanks for joining us again. Appreciate it.
Good morning. Glad to be here.
So we find out last week, thanks to this piece by you and Tomas Philipson, a colleague of yours who's over at University of Chicago, professor of public policy there, that the White House actually did prepare for a pandemic, and you two, among others, were in charge of that preparation, and it is particularly relevant to the pursuit of a vaccine. And this was last fall, and I just don't know why this. I'm glad you told the story, you and your colleague. I don't know why this story hasn't been told. Maybe it should be told this week as part of the convention, explaining to the American people what exactly the administration was doing in advance of knowing that this virus would strike in 2020, and then what it's done every step of the way since. But the preparation for the pandemic, explain.
Well, so, you undoubtedly your listeners have heard the story that was circulated last week by the Democratic Convention that the Trump administration was dysfunctional, according to Governor Cuomo, my state, New York, that it's incompetent, and it didn't even see it coming. And just the reverse is true. We were commissioned by the National Security Council, which was concerned about the health impacts and the economic impacts and the impact on national security that an influenza pandemic could have. And they commissioned us to write a report on what those impacts could be and what we ought to do about it. So I was part of a team from Philipson that wrote this report, and we talked about the severe impacts in terms of lost life and economic losses and health losses that have, and we discussed strategy to improve vaccine production and limit those losses. Well, and those lessons were applied by the administration to the new coronavirus.
Do you think we'll have a COVID vaccine before the end of the year or early next year?
It's tough to say. I mean, vaccine production normally takes many years and billions of dollars, and we've had an incredible, unimaginable progress. We now have about 6-7 vaccines in stage trials, so I think there's a good chance. But in any drug development or vaccine development, it's always a risky proposition. So I'm very optimistic, but who knows?
Well, and there's a story out in Financial Times about the White House looking to potentially fast track the AstraZeneca offering. Is there any reason that well, I don't know. Number one, if you know if that's true or not. Number two, is there any reason at this point, any basis at this point, to try and fast track one of the promising vaccines in development from the others?
No, I think what's happening is the administration is pushing the FDA to remove any kind of barriers to vaccine development and to get something approved quickly. But I think the FDA has been very clear they're not going to cut any corners. They want to really make sure things are safe and they'll be effective. So I don't think anyone needs to worry that this is going to be pushed through and it's not really proven to be effective. So I don't know specifically that they're pushing the AstraZeneca one. I know there have been reports. I think the administration is really pushing any of the vaccines that appear promising. As
well as therapeutics, with the FDA authorizing the use of convalescent plasma.
Correct, and they were very early on authorized remdesivir, which is a drug which has proven to shorten the course of COVID-19.
The story in the Wall Street Journal over the weekend mentioned a bit earlier in the program about the Congress allocated $25 billion for federal agencies and states to expand testing, develop contact tracing initiatives, broaden disease surveillance. And this has been the mantra of the Democrats about testing, contact tracing, and all that. According to HHS data, only about 10 to 15% of the $25 billion allocated has been drawn down in the ensuing 4 months. How should we understand all that money being allocated, all that emphasis on testing and contact tracing, and here we are 4 months later, and a small fraction of it's been deployed?
Well, the thing is, things like testing and contact tracing are typically undertaken at the state and local level. And many of the states do not have well-developed enterprises to do this. They just aren't unprepared, and they haven't been able to ramp it up quickly enough. So many of those efforts, while we've known about these, and these are well-known public health measures that have been known for decades and longer, they're not really set up at the state and local level to do it, and they therefore have not utilized all the funds that have been made available to them.
What are your thoughts about all the college campuses reopening, and then somebody will get it, and then next thing you know, 324 people at Georgia Tech have it, but nobody needs to be hospitalized? Why shouldn't that be pointed out to people that everyone's getting tested? And so now, are we starting to have some type of herd immunity?
Well, herd immunity requires, it depends exactly on the particular virus, but herd immunity requires a substantial portion of the population to have been exposed and now be immune. And we probably aren't there yet. But as far as the schools go and the college campuses go, the important thing, which we've known for a very long time, is that the people who are most vulnerable to this virus, who are the people who are going to get the severe disease, the people who are going to go on to die, are elderly, and they're people with underlying medical conditions. And the vast majority of people going back to college don't fall into either of those categories. And as long as we take precautions to safeguard people who fall into those categories, whether they be elderly professors or elderly people who work at those universities or younger people who have medical conditions that make them vulnerable, it's reasonably safe for those kids to go back to school, along with proper precautions. But if you take those precautions, you may get some people infected, but they're very unlikely to go on to serious disease and death.
And it seems to me that the reporting and the discussion on this is so stilted, as if, for example, and Tyler Cohen writes about this at Bloomberg, if you end college football, then everybody just goes back into some hyperbaric chamber where they wait out the virus, rather than what actually happens, which is kids are on college campus, even if they're just taking classes remotely from their dorm room, and they're much more likely to be fraternizing, whether literally in a fraternity or out at the bars or at a restaurant or on the beach or wherever. And Cohen writes, for all the talk of banning athletics, how about university regulations banning all alcohol consumption, including off campus, for all registered students under the pain of suspension? Because, look, what we know is it's not athletic practices, it's more social congregations where the virus has spread to the extent it has among this age cohort.
Yeah, well, I mean, look, as we know from our history of prohibition, banning alcohol is not something that's so easily accomplished. However, I think the important thing to know is that if kids are on campus where you can establish rules and enforce them, they're probably much safer than if you send them home where you can't enforce those rules and where they're then going to go infect their grandmothers and family members who have various underlying illnesses. So
yeah, I mean, I think I think whether you believe in the alcohol restrictions or not, it's sort of secondary. Just to the this is on every topic related to COVID. We pretend that there, not we meaning you and me, but that people pretend there are no trade-offs. If we just do this, then it stops everything. Rather than no, it creates the response, and the response is this. Now, what do you do about this? And then you're chasing your tail.
Right, and what's happening is they're saying don't come to campus because that's too dangerous. So where do they anticipate those kids are going to go? They're going to be living off campus and going to the parties that you described, whereas if they were on campus, you have a much better chance of policing it.
Something else that's happening at the state level, in particular, these quarantines for travel to hotspot states, however defined, and that's always a moving target. You wrote about this in City Journal recently, characterizing these quarantines like the one initiated by Governor Cuomo in New York, which is not dissimilar to the one initiated by my home state Governor Pritzker in Illinois, that they're pointless.
Right. Well, I mean, Governor Cuomo, along with the adjacent states of Connecticut and New Jersey, has initiated this quarantine that now covers more than 30 states. In other words, outside of the Northeast, virtually every state in the Union is considered a restricted state, and people have to quarantine for 14 days if they come back from one of those states. So first of all, it's a relatively unenforceable thing. Secondly, what does it do? It penalizes New Yorkers. They now can't travel to any one of those other states without tacking 2 weeks onto their vacation or business trip. And it also penalizes New York business because no tourist and no business person is going to want to travel to New York if they have to quarantine for 14 days. And the problem is it doesn't accomplish anything. If you look at the criteria they set up to define a restricted state, it means that any state that has about a 1 in 10,000 chance of someone being infected is on that list. That's a minuscule chance. And to say that those people should be restricted, any random traveler without any other information should be restricted, is just silly.
And also, you note it does not apply to people who stay in one of these hotspots for less than 24 hours. But there's nothing magical about 24 hours. That's an arbitrary number, too.
That's what I wrote. Someone who's in a COVID hotspot for 24 hours and goes to the gym and goes to a restaurant and gets a tattoo, they're okay. They're
right.
They're there for less than 24 hours. Someone who spends 2 days in a remote cabin in Montana, they're restricted. They have to be quarantined. It's just completely nonsensical.
Completely nonsensical. That seems to be a phrase that keeps rolling through my mind over the months as we talk about COVID-19. And one last reaction I want to get from you, the head of World Health Organization, as well as one of Britain's top scientists on the topic, both suggested, well, they suggested to varying degrees. Tedros suggesting that it may be 2 years until we're able to eradicate the virus. The British scientists suggesting what others have suggested, that this is going to be with us in some form or fashion for many years to come, perhaps forever. And so we probably need to start thinking about the standards for living our lives if this is going to be a part of it for an extended period of time.
Well, no one knows is the problem. And no one knows whether this is going to be like influenza with the flu virus, which is something that is what's termed endemic. It's with us all the time, and it mutates a little bit from year to year, so we have to make new vaccines every year to combat it, or whether it's going to disappear when we reach herd immunity and or get a vaccine. So, but the problem is it's probably going to be something we learn to live with. And thankfully, this is not Ebola. This is not something that carries a 50% mortality rate when you're infected. This is something that's a bit more fatal than influenza, but thankfully not Ebola. So I think we will learn to live with it if it sticks around.
Yeah, 99.98% survival rate, correct?
Well, you're somewhere in that, yeah. If you're looking at actual infection rates, what people don't understand is probably about half of infections are asymptomatic, meaning the people they don't show any signs of illness. They don't even know they were infected.
Yeah, like college
So
kids.
that immediately tells you how mild the disease is. And most of the remaining people have a mild case of the disease. So if you look at truly at not the number of known cases, but at the number of likely people infected, and then look at the fatality rate, you're at probably at 0.2 to 0.5%. And it's concentrated, as I mentioned earlier, in particular age groups. So if you're in the younger age groups and otherwise healthy, it's vanishingly small chance of death.
He is Dr. Joel Zinberg. He's Senior Fellow at the Competitive Enterprise Institute in D.C. and Associate Clinical Professor of Surgery at Mount Sinai Hospital in New York. Dr. Zinberg, thanks for joining us again. Appreciate it.
Thank you. Have a great day.
Thanks. And he joined us on our turnkey.pro answer line.
Listen to podcasts of Dan and Amy from the AM 560 mobile app. Download it today at 560theanswer.com/mobile.
There are a lot of tough questions when thinking about caring for aging parents or loved ones. Most importantly, can they stay safe at home? With Home Care Angels Home Services, they can. Home Care Angels has been caring for seniors in their homes with compassionate and holistic non-medical care for the past 15 years. The Home Care Angel caregivers are certified in dementia care, COVID-19, and in-home care. You'll get highly qualified caregivers carefully selected for your loved ones to help with activities of daily living, meal prep, light housekeeping, or 24/7 live-in care. Due to COVID-19, they've taken extra precautions and implemented protocols consistent with CDC guidelines to ensure the quality and safety of all their clients. Home Care Angels is in Des Plaines, Illinois, and services all of Chicagoland and the suburbs. To request a free in-home assessment, call 847-824-5221. That's 847